What are some signs that mothers, especially new moms or pregnant women, should be looking at that they're experiencing maybe something greater than pandemic related anxiety or depression?
Right. I always just kind of take a look at your sleep, your appetite, and your energy. Those will tell us a lot. So, of course, we're sleep deprived as new mothers, but if you're noticing that it's even more difficult to get out of bed, you're just not motivated to do things, and the energy is low. And it's really difficult saying this for a parent because naturally, as a new parent, you already have all these things, but you notice it even more. So, to the point that you're not able to wake up for the feedings, or you're not at the point that you can't even just wake up and take a shower. So we look at your kind of daily routine. And if you notice a big difference in that, where it takes such an effort for you to do all those things, then we really pay attention to, okay, maybe this might be more of a mood episode rather than it just being baby blues or a reaction to the pandemic.
What is a telltale sign that they need to make sure they get help?
A telltale sign, I always say, if there's ever any risk of harm to self, that's a big sign for us. So if you ever have, and it doesn't have to be something like specific, it could just be like, if I were to fall asleep and not wake up. So we pay attention to the words that are used. When people kind of reach that point where they're just giving up, they don't want to kind of meet their obligations as a parent anymore, that's when it's time. Just for postpartum depression alone, without a pandemic, it's about 10 to 15% of women who get it. And I already think that that's actually underreported. I think it's way more than that. So with the pandemic on top of this, we have to be even more kind of observant of what's going on with our new moms.
I think a lot of times when we go through, mental health challenges, we blame ourselves. We say there's something I'm doing wrong. I didn't do this right. I didn't do that right. What can you say to mothers who are blaming themselves for not feeling well?
I say, Mom, you're doing great, first of all, because especially guilt is actually a symptom of depression. So we see that in postpartum depression where moms are feeling like they're just not a good enough mother, they're not a good enough wife. Take it easy on yourself. First of all, you're doing this as a new parent, which is already difficult, but you're doing this during a time of a public health emergency. So I try to just help women take that weight off of themselves where they're constantly just beating up on themselves and saying, oh, I'm not doing this, I'm not, your kid is living. Okay, and we are getting through this, and we are going to eat, and your kid is fed, and they're sleeping. We're in survival mode. So I really just tell them to kind of take it easy on themselves.
What do you say to parents who think, oh no, something's wrong with me or I'm alone in this?
No, I always tell them, because that's the reason why it is underreported, because people think, how could I feel this way? I should be joyful. I have a new child. So it's almost like there's a sense of shame associated with it. But I say it's actually quite common. And I always remind them that there's people who are experiencing the same thing as you are. And the reason why it's often underreported is because people just kind of label it as baby blues and just say, oh, this is just something you go through. And, family members contribute to that. They'd be like, oh, girl, this is how it is the first few months. You'll get out of it. But you have women who don't get out of it for a year and who can't return to work because of it. So I always say, let's err on the side of safety and let's go ahead and just get it checked out, talk to a professional. Like I said, it could be your family medicine doctor, it could be your primary care, or just talk directly to a therapist or a psychiatrist, talk to somebody. Because I'd rather the professional be the one to be like, okay, you're doing okay. I'd rather us make the judgment rather than you.